Such an important night. Thank you for joining us for Open Line. The Affordable Care Act deadline is coming right up Saturday at midnight. If you have questions, now is the time to call. We have our lines open right now. 615-737+ is the number to call. Also, grab a piece of paper and a pen. We're going to give you another important number where you can actually get hooked up with a navigator to walk you through this process before Saturday. The sooner you call, the better, though, right?
Yes.
Where are you meeting people? You mentioned the libraries. Anywhere else?
And most of our volunteers are at libraries, but you have them a little scattered a few other places.
So we have a lot of navigators at libraries just because they're great. They're in the community. They're in the neighborhood. But we're also at some health clinics. So that's great, mainly serving the patients of those clinics. Also some community centers. So here in Nashville, there's Hispanic Family Foundation, which is an Hispanic community center, so we're there. There's an Hispanic community center in Memphis called Latino Memphis, and we have a navigator there as well. So community centers, libraries, health clinics, those are our main areas.
And the 844 number will get them connected.
Yes,
I mean, one of the first things we'll ask them, what is your zip code? And so that zip code, our calendar and our search engine that finds the closest navigator is all done by zip code. So once we get their zip code, then we can connect them with the closest navigator or sister. And
here is that 844 number. I know we're going to pop it up because Taylor in the back is going to do it for me. There it is. I knew it was going to happen. 844-644-5443. Let's leave that up for a second because I know that people will want to call. This is the number. You're going to have to leave a message. Just give them your name and your number to call you back, and they're going to do that within 3 hours to hook you up with a navigator and just get that process rolling. Sounds like you have it pretty streamlined.
We've been working on this for almost 6 years.
This is the 6th open enrollment.
I mean, I suppose it's not often where you have such organizations that have worked so long together. And actually, it was the second open enrollment where we got the 844 number. We didn't have that the first year.
We didn't have that at first,
and we didn't have the connector, which is the electronic calendar scheduling system. So we've sort of
come a long way in 6 years. Really have. As we mentioned before, this is such an important thing for families. It can make or break a family, not just for the year ahead, but for years ahead. If you get into an accident, have an unexpected surgery or illness, we're talking thousands and thousands and thousands of dollars that you could owe.
The number one reason for personal bankruptcy are medical bills.
I believe it.
That's the number one reason. So, you know, we'd like to save families from that grief that they would have to go through. So we'll help them understand what their best options are.
Yes. Now, believe it or not, some people do not qualify for the Affordable Care Act. Let's talk about who that would be.
Oh, you know, those are tough conversations. I had a conversation this afternoon with a grandmother who is caring for her granddaughter who's 24. And her granddaughter is working part-time. She has some health issues, so she can't work full-time. She works part-time at a Dollar General store and makes $7,000 a year. Well, a single person, that's a single person who has no children. If she had children, then she could sign up for TennCare or sign up for the Affordable Care Act, but mostly TennCare likely. But a 24-year-old single adult, and if they make less than $12,160, $140 or whatever, they're in the gap, and they're not eligible for TennCare. They're not eligible. They can sign up for the Affordable Care Act, but they get no tax credits.
Which means you're only available to the most expensive plan, which isn't reasonable.
Which is not going to be affordable.
Right.
I remember this happened about 3 or 4 years ago. A father came in with his daughter, his older daughter, adult daughter, and she says, I want you to help us sign up. And so, and I asked some of those preliminary questions. I said, well, she's going to fall in the gap. He says, I don't care. I'm going to pay for a premium. I'm going to take care of it. And so we were able to get that coverage for her because she had someone who could pay for it.
Right. A lot of people don't have that person, though. Yeah. That certainly has to be a very hard conversation when you say, I'm sorry, you don't qualify, and, you know, send them out the door wishing them the best for the year ahead. Obviously, that's something that has to be worked out with our state government and perhaps the federal government as well, but more likely the state government here in Tennessee. Also, parents of children, you mentioned, who maybe have the parents have a very, very low income, TennCare comes in. Parents with children who have serious health concerns or disabilities, responsibilities. What about for parents, though, or even just married couples? Does it sometimes behoove them to sign up for different plans?
So often we will help families where the kids may be on TennCare or Cover Kids, but maybe the parents have gone without insurance. Because the way that TennCare works, for the parents to be included, their income has to be on the lower end. Sometimes the parents' income is too high for the parents to be included, only the kids are covered. And the parents have just gone without because they didn't think they could afford coverage. So we can help them apply for Marketplace. Sometimes families come to us and the whole family has lost coverage. Maybe they had TennCare, but they lost it, and we're able to apply for them. And sometimes the parents are on Marketplace, a couple kids are on Cover Kids, some of the kids are on TennCare. I mean, believe it or not, all three is common in a household. As far as spouses signing up for different plans, there are options where you can, so the Marketplace will kind of group people and say this is your suggested group, so married, family together. There are some people that have to be in separate groups. So if a married couple is claiming an adult child, sometimes it will make the adult child be in a separate group.
Gotcha.
So they can still get coverage for their adult child, but they'll technically be on a different plan. Most of the time for married couples, the same plan works well. You can separate the groups. For example, if one spouse has really high medical needs, so they know they want to get a silver plan, but the other spouse doesn't. But most of the time it works out to where it's the most beneficial for them to be together still.
Once you go through the process, and you mentioned you can walk through that with the navigator all the way till you're clicking done, can you be then kicked out or something denied after that? Or are you automatically in once things are approved?
As long as you pay your first premium and get your coverage started. So as long as you're paying your premium and you're sending in all the information the Marketplace requests. So one important thing that navigator, volunteer assister, CAC could help someone with is when they apply, reading their eligibility notice very carefully. The eligibility notice is generated as soon as you're finished with the application, right away. It's a letter that comes up on your screen, and it will let you know if you need to provide any additional information. So sometimes if the income information that you put into the application is different than what the government has on record for you through your taxes, they're going to ask you to verify your current income. They give you 90 days. So in that interim, you can go ahead and sign up, get a plan started, but if you don't get that verification submitted, your coverage could be ended. But as far as for medical use, they're not going to cancel you. So that is one question that I get sometimes. If I start using my plan too much, are they going to cancel me? You know, if I come down with this condition, will I get canceled? That's not going to happen.
Great information. We're going to take a quick break. When we come back, we're going to give out that 844 number, so have that pen and paper ready. Stay with us.